Welcome back to TV5 News at 9. There have been discussions to protect Medicaid. So joining us this morning, we have Angela Williams and Jeff Larson from Great Lakes Bay Health Centers. Thank you both so much for being here.
Thank you.
We appreciate it. Jeff, we're going to start with you. Can you help us understand how federal funding and Medicaid insurance benefits, community health centers, the patients they serve, how does all this come together?
So at Great Lakes Bay Health Centers, we are here as a safety net. So we will never turn away anyone, regardless of what insurance coverage they have, even if they don't have insurance coverage. But our sweet spot is really Medicaid. And so sometimes up to 2/3 of our patients are Medicaid patients. That number's down to half now. And these potential cuts to Medicaid are projected to remove coverage from about 25% of the people that currently have it. So that would mean that we would still provide care for those folks, but they would more likely be uninsured, which would mean far less reimbursement to us, which puts in question our sustainability and may limit services to all as a result of this.
If you could also talk a little bit more about how even a reduction in Medicaid funding would affect access to health care, particularly if you rely on a community health center.
Well, and even if you don't, I mean, yes, this would be catastrophic. And so the likelihood of access being jeopardized to us exists. But this is not just an issue for people who have Medicaid, because that will mean more and more folks are going to hospitals. Hospitals will likely have to increase rates to offset that loss, which will make care for you and me more expensive. The insurance premiums for employers more expensive. 2/3 or more of people in assisted living facilities are on Medicaid, so they'll probably have to close or reduce access. So do you have a plan B for your aging parent that is there currently? Like, when people look at this and assume, oh, I don't have Medicaid, so this doesn't affect me. No, it's going to affect everyone.
Well, and if we could even ask Angela, when we talk about community health centers and why they're so essential for providing, accessible, affordable health care to low income and underserved populations, what are your main concerns?
Well, we provide that primary access to health care, whether underserved, underinsured, or even public or private insurance. We're there in the communities where the people are. We meet the needs of the community by providing primary care, medical services, dental, behavioral health services. And so if there is a potential of negative impacts, then how are we going to serve those who are in need?
Well, and I also want to ask about the impact of potential cuts on healthcare providers.
Well, for healthcare providers, too, we're concerned about long waits in the ER, because if these services are not available, and one of our goals as a community health center is to keep people out of the hospital. So we focus on that preventive care aspect of your life. And so it means potential for longer waits, people not being able to get the specialized services they may need for a surgery, or even I have a toothache which ends up becoming severely infected and needing a specialist versus, going to a regular dentist. And so there are many negative impacts for our patients, and Great Lakes Bay Health Centers, we focus on providing health care services for everyone, regardless of what's happening with their ability to pay.
Well, and Jeff, we can tell you are very passionate, both of you, about this. If someone is watching at home and is very concerned and wants to make their voice heard about all this, what do you suggest?
Yeah, absolutely, and we hope people are. So we understand the benefits of living within a budget. That's responsible activity, but some of these proposed cuts, keep in mind, these are only proposed at this point in time. They've not been voted on. And so if enough people, we really do believe in grassroots efforts. People can reach out to their senator, to their congressperson, and tell them that these specific cuts are unacceptable. I spend time in Washington, D.C., I spend time in Lansing. I know that in the political system, your voice matters. We often get overwhelmed and feel like it doesn't, but in talking to these folks on a regular basis, they want to hear your stories. They want to hear what these cuts would mean to you, because they truly will vote based on that.
All right, and what do you want to close with today, Angela? Do you have a message?
I always have a message when I'm on here every month. And first of all, I always stress the importance of health literacy. If you don't understand what your doctor is saying, if you don't understand this issue with Medicaid, try to become more educated. Ask questions. Don't be embarrassed, especially with Medicaid. Understand what your rights are, what services are provided under your Medicaid plan, so that you are more educated and can be proactive about your services. But at the same time, at Great Lakes Bay Health Centers, we encourage everyone to take care of their general health. We are accepting new patients. In addition, we see the prevalence of measles and flu, especially in our kids. Get your family vaccinated, as well as, again, knowing your health status. And my last message to our community is we're celebrating National Nurses Week, Caring Hands for Powerful Voices. Nurses are a vital part of every entry level of healthcare. So congratulations to nurses. I've been a nurse for 45 years, and I should be celebrated, as well as everyone else who has sacrificed and dedicated with compassion to nursing.
Nurses are true heroes. When you think about the last several years, especially front lines, what they have done,
yes,
there's nothing like a nurse. We owe them so much. So
yes, we do.
Thank you for being here. You can also find more information on this if you click on the hot link section of WNEM.com. But Jeff and Angela, thank you so much.
Thank you.
All right, we're back in a moment.